This video is brought to you by Dickinson State University's Nursing Student Association with Pat Billings, who does AED training from CHI St. Alexius Health Dickinson. I'm Jackie Murray.
I'm Cassidy Peterson.
And I'm Ridenhower. This video will demonstrate how to properly use an AED and the different AED locations around Dickinson State University.
Okay. So, here we have Mr. Jones. He just collapsed on the floor. So we're first going to start by assessing the scene, making sure it's safe for us to perform CPR and do an AED. So once you found he's collapsed, you check, Mr. Jones, are you awake? Mr. Jones. As you see, he's not responsive. So then you start by clearing the chest so you can apply your AED. You would call somebody to go get the AED while you start chest compressions, but for the reason of this video, I have my AED here. You first start by removing the cover of your AED. You remove your pads and you press the power on button.
Okay. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest.
Here's your pads. They tell you where they go, so you remove your tab and place them right where they tell you to.
Attach defib pads to patient's bare chest. Don't touch patient. Analyzing.
Clear.
No shock advised. Start CPR.
So there are a few important takeaways with AED and CPR administration. For one, when you administer the AED, just be really sure that you're listening to all the different directions the AED is telling you. If it's going to give shock, you need to make sure that you and any other CPR assistants that you have around you are not touching the victim when the shock is advised. If there's no shock advised, it will tell you to resume CPR and you will do that. If you're with a second person who can help perform the compressions, then this is a good time when they give the shock for you and the other person to switch so you don't get too tired. And it's also important to continue to perform CPR and use the AED until emergency services arrive. So that may mean that you're going to be doing CPR for a long amount of time. There may be multiple shocks given. You're just going to continue that until those emergency services come.
Now we will show you the different AED locations around DSU campus. This AED is located in Kleinfelter Hall on the first floor, right outside of Beck Auditorium.
We're standing outside of Scott's Gymnasium foyer, and here's the AED.
We are here in the lower Weinbergen gym in front of Tim Kreit's office, and inside is an AED. It's green and it's on the ground behind his desk.
I am by the east entrance of the E plant. Here is the AED. I'm sitting here lounging in the east entrance of DeLong Hall, and here's your AED.
I'm here on the first floor of Stickney Hall, outside of the health services, and this is the location of the AED.
Okay, I'm right outside the main entrance of May Hall, and here is the next AED.
I'm currently standing outside of Stockton Library. The AED is, if you go through the doors and around the corner, it's right outside the offices.
This AED is located in Selke Hall on the first level in the lounge.
We are here inside the Student Center in the main entrance, and here's the AED.
I'm here, standing inside of Wood Halls between the two entrances, and here's your AED.
This AED is located by the south doors of Murphy Hall. This AED is located in the south main entrance of the Ag Building.
I'm here in the main entrance of the BAC, and this is where the AED is located.
I am in the lower level of the BAC on the first floor, outside the training room, and here's your AED.
Talk with CHI St. Alexius Health Dickinson, where Pat Billings explains how to become involved in Dickinson's Cardiac Ready Community Initiative.
One of the goals for the Cardiac Ready community is to increase our community's awareness on cardiac emergencies, to increase our chances of survival and recovery from cardiac emergencies, and everybody's knowledge on the importance of AEDs and CPR. The first step in the chain of survival is if you find somebody unresponsive, then you want to call 911 immediately and get help there. The next step is if the person is unresponsive and not breathing normally, is to begin CPR, pressing hard and fast in the center of the chest. The next step is to get an AED on the scene as soon as possible. If there's an extra person there, send them to get the AED. You should continue CPR and the AED use until emergency services arrives.
To get involved, Call Pat Billings at 456-4469.